Hi. Sorry
Hi.
about that. We're having a complete conversation on our own on my channel. So,
Oh,
and I was just beginning to answer question after question for people. So I'm
oh my
glad that we're here
goodness.
together. You are
Okay.
glowing. You look
Oh my
great.
gosh, thank you.
You look so good.
Oh, thank you.
How are
I'm
you
also
feeling?
next to a window, which helps with the natural glow. I'm feeling really good. I am just at the beginning of the third trimester, so I think
Wonderful.
things are about to get really real.
That is wonderful. You're getting there. Wow, it goes by fast. I got to tell you,
So fast.
after we did that panel and you reached out to me afterwards, it was very special. I really loved how open you've been about this journey. And I can tell you that it helps so many people. It's helped so many people during this process. So good for you. Tell us,
Thank
let's
you.
go over everything so people can kind of catch up on where you and I are jumping into it. But I want people to know a little bit of background of where we're coming from.
Yeah, so as I was just saying, I've shared so much about the IVF journey thus far on my Instagram. I did a bunch of videos just kind of saying how we struggled to get pregnant naturally. And then we turned to a fertility specialist who then we decided to do a series of things before choosing to go to IVF that didn't work. And so we then, I think maybe a year into that process, decided to go to the IVF route. And, I feel like I've heard so many stories of people's journeys throughout IVF. And I do feel like we kind of got a success story on the luckier side. I only had to go through one round of stimulation and one egg retrieval, and we were successful in getting a good amount of eggs and therefore embryos. And my second transfer took,
Yeah.
which was awesome. And now, I'm in my third trimester. So it seems like it's been a long journey to get here, but it feels like once you're here, you don't forget about how long it took or how hard it was, but you just feel, I don't know. It
Relieved.
was all so worth it. That doesn't feel like such
Yeah.
a crazy ride, but it was a crazy ride, which is why I wanted to talk about it. Because when I was going through it, I felt like, there wasn't really a lot of places for me to turn. I felt not necessarily alone in the process because I did share with my closest friends that I was going through this, and I did have my husband as a huge support system, and again, and my friends. But it was just like there was, I didn't have I didn't go in and find like a Reddit community, and certainly didn't have anyone publicly kind of sharing the breakdown of what it was like or what to expect or what they went through or the failures or any of the things. So I really also being kind of isolated in the beginning of my pregnancy through the pandemic and not really sharing the news publicly yet, I just thought it was a good opportunity to kind of record a bunch of information
Oh, nice.
about the process. Yeah, and kind of get that not only off of my chest, but also out into the ethos of the world so that other women didn't have to feel so alone. So that's kind of like my background. And then obviously we met virtually. During the pandemic, we did a panel together. Dr. Ghadir is a renowned fertility specialist out in LA, and we had the opportunity to speak together on a panel, kind of breaking down some of the just like barrier to entry types of conversations around IVF. And we had such a great response to
Yes. It was
that
incredible.
panel. It was amazing. So I just thought it would be good to kind of do a follow up and talk about all the things. We got a lot of questions. And Yeah, I mean, should we just jump right in, or do you want to
The
give a
panel,
little
so
background?
the panel was great, and it's on my YouTube channel. If anyone wants to see the panel that we did, it was encompassing so many different aspects of, from mental health that has to do with fertility, for physical health that has to do with fertility, from some human perspective, which is, I think, the most important aspect of someone who is going through and being very honest about their fertility. I think that when looking at any person struggling, because it's not easy at all. It can be very, like you said, you had friends and you had people that were involved in your life and family, but at the same time, you still feel struggled and you feel alone in some ways. So I think just like you're doing, Hannah, right now, talking about this and being incredibly open about it is helping so many people that you wouldn't even realize right now. I can't wait to see what you're going to do with the videos that you filmed. And are you going to put something together with that?
Yeah, so I've put out a lot of different videos over the last couple of months. My husband and I had a lot. We did like a compilation video of like our IVF journey thus far. There's one that lives on his YouTube. There's one on my IGTV, and then I've just kind of been filming different updates, whether it was the first trimester, 20 weeks, what I eat in a day, type of stuff. And I did a little like reflecting on the IVF process. That's also on my IGTV already.
Oh, fantastic. Okay, great. So I'm so glad that you put it all out there. I'm sorry I'm a little bit behind the game.
No, don't worry.
I'm glad that you've done that. But I think what's really important we should talk to here, there's probably someone out there right now that's wondering, oh my God, I'm having such a hard time getting pregnant. What do I do? So is there anything that you wanted to share about how you found the fertility center? We don't live in the same town. We have people coming to us, but this was all happening before we had the luxury of meeting. But I think that's the first best way to help people is teach them what to do just to get started, because that first step can be very difficult.
Totally. The first step can feel really difficult. And also, I feel like in the pandemic, a lot of people or a lot of cycles were stopped. Yes. So I feel like it could also feel a bit stalled. So something that we like, the reason why, I mean, I'm kind of a type A person. And so after 6 months of trying naturally, we decided to see if there was something going on. Most people, I think, wait a little bit longer. And I do know that some insurance really doesn't kick in until you have been trying for a year. So yeah, I don't know. I mean, for me, I was just like, I went to my gynecologist and I was like, listen, it's not happening or it hasn't been happening. And my patience is low, and my husband and I are traveling so much. We're not always in the same place, especially over the next couple of months as we look to the future. So what can we do to help increase our chances?
How did you pick your fertility specialist? Did you speak to your OBGYN?
So my OB gave me a recommendation for my specialist. And when I went to meet with my specialist, I absolutely loved her. But I think if I had not loved her, I would have reached out to a few friends and asked if anyone had recommendations, because I do think that your team is super, super important.
I think your team is super important, and I can't agree with you. You have to have some kind of bond and relationship with your physician that is going to be taking care of you. It's difficult to build this tremendous bond right now because most of what we're doing is remote, and we're doing consultations by phone, and people are coming in, doing a blood test and an ultrasound and going quickly home. So it's been challenging for us. I have a rule that I call every single person back the day that they call me, and I never let it go to the next day. And if I haven't called you back and it's 5 o'clock, I have a line that people can call, and it pages me to answer any important question that couldn't wait to the next day. So I think that's really important. But definitely having, like you walked in and you really enjoyed meeting your fertility specialist, I think is the first most important thing. However, from a doctor's side, I think it's also very important to make sure that the clinic that you've been referred to has a great reputation and is at the state of the art and the newest technologies that's out there. So things to ask, I think most fertility clinics right now, the top ones, do frozen embryo transfers, not fresh transfers. That's one. Two is that I think genetic testing on an embryo is very important. I just don't believe in doing all of this and then putting an embryo in and just praying that it's going to be normal. I think it's really important that the lab that is working knows how to do biopsies on day 5 embryos, which are called blastocysts. So those two things I think are really key. And if you do the embryo transfer. Now, for many people, some clinics are now doing practice months called ERA mock cycle. It's a practice month where you check the lining and make sure everything was done absolutely perfectly before putting the embryo back in. If you've got a lot of embryos, I don't know if you have to do it to begin with, but some people choose to and some people don't. If you have limited number of healthy embryos, I would recommend it for everyone. So these are things that I think are very important. I'm not sure if, I gave a lecture last year in Detroit, and there was about 50 to 60 either nurse practitioners, physician assistants, and doctors in the room. And we started to talk about ERA, and I was noticing like a lot of this, as if I was talking a foreign language. And I asked, does everyone know what an ERA is and has heard of it and does them? One person said they had heard of it. And it was something that had already become a big part of our practice. So I think the learning curve has grown rapidly because people using ERA practice cycles are doing so much better. But ERA actually has given us a lot of very, very helpful information, at least for our practice. And we're very proud that we have it. And I would be concerned if a practice says like they don't do it or it's just not part of their practice. So it's not for everyone, but it's important to know that the option is there.
Okay. Now tell me, you mentioned a few things that I just want to kind of touch back on. You mentioned one, frozen transfers versus fresh transfers.
Yes.
And you also talked about genetic testing. So first of all, frozen transfers versus fresh transfers. What happens if you're in the scenario where you only have 3 eggs or embryos, rather, 3 embryos, and it doesn't, the likelihood of those embryos making it to the day 5 to then be sent off to genetic testing is low. Would you then recommend
really good question.
A fresh transfer?
No. And I'll tell you why. If it's a good embryology lab that has great success growing a healthy embryo all the way to the blastocyst stage, which is the day 5 embryo, if it's not getting there, it's probably a very good signal that the embryo is not a healthy and good embryo. Okay? So if the lab doesn't have a good capability of growing the embryo out, and there's only 3 or a very low number, there's a very, very high likelihood, like almost 99% and above, that the embryo may not be healthy. Okay? So I'm a very firm believer that if an embryo isn't going to grow for 5 days in the lab, and we even wait to day 7. So we always check for blastocysts on day 5, 6, and 7. So we're giving even 48 extra hours of growth. But if an embryo is not making it to a good-looking blastocyst, the chances of it making a healthy, beautiful embryo and a beautiful baby for you is almost 0. So
interesting.
It's better for me to say, okay, well, we have only 3, but let's not do something blind and just put 3 embryos fresh for someone. I'd rather wait and see what goes out. And I've had many scenarios that a patient only made 1 that went to the blastocyst stage. And guess what? That 1 came back normal. And then we did an ERA, and then we did an FET, and there was implantation, and everyone did really well. So that's a really important thing for us. We have a very good lab, and I'm convinced that if an embryo is not going to get to the blastocyst stage there, then it may not get to a blastocyst stage anywhere. Now, if another place is telling you that, it may not get there, I have a couple concerns. One is that the lab environment is not that good, and their lab isn't as successful at getting to what we call blastocyst stage, and that's concerning. Second is that there's a lot of studies that have shown bring all of its hormones back down to normal. And once we bring your body back down to normal, there are less complications in your pregnancy. So when you put an embryo back and your estrogen is super high and all these things have been going on that are not very physiologic as a result of the stimulation cycle, it's not the best timing in your life to actually become pregnant. Now, we were doing this before. I have twins. They were from a fresh transfer. We used to do a biopsy on day 3 and on day 5 do a transfer, and it went well. And this is 9.5 years ago. So it still does work, but I think it's a much safer way now to do the most advanced genetic testing. The genetic testing usually takes about a week to 2 weeks to get the result back. We like the body to become much, much more natural as well. So those things together are a reason to do frozen embryo transfers. If the lab does not have a great success freezing and thawing embryos, I have a lot of concern about that as well.
I didn't realize that your twins were from a fresh transfer.
They are, because they're 9 years old. Well, they're almost 9 years old. So we did IVF about 10 years ago.
Wow.
And there was no frozen transfers then. I mean, it was just like if you had to do a frozen transfer then.
Right.
So we decided to put 2 embryos in. And in those days, I mean, it's incredible, but we used to do a biopsy when the embryo was 8 cells. On day 3, we used to take 1 cell out, which is an eighth of an embryo. We find it to be much, much, much safer now when you have a hatching blastocyst. You take a couple tiny cells from the outside, and by then the embryo is something between 150 and 300 cells. And
right.
We know that section that's pouching out is the placenta. So you're not taking critical cells from the inner mass of where the embryo is growing and where the baby's going to be. So
right.
it has done incredibly well that way, but now we think it's much safer to do it this way.
So I actually, something to note about my own personal journey is that I took 3.5 months off after I did my stim and my egg retrieval. I took 3 months off of everything. I just wanted to get my body back. I wanted to get my mental,
yes.
emotional
yep.
situation sorted, settled. I wanted to travel, all the things and then I was like, the top of the year, I was like, okay, now I'm ready to go back into this.
So it's a really smart thing to do.
Yeah. Really, and I felt mentally prepared. I felt strong and confident in my body. Like I felt like I'd gotten all the hormones out and that my body was kind of back to its regular self. So it's cool to hear you say that you also think that that's
I think it's a great idea, but I have to say, I think it's a great idea for someone who made a great number of embryos and is now really happy with that.
Yeah.
And is not like 40 years old.
Right.
And the reason I say that is because let's say you are 38 or 39. Let's say you only made 1 or 2 embryos. It's I think taking time off then, listen, a month isn't going to kill anyone. Ever.
Right.
So I always tell when people are making they get so razzled about, do I take a month? 1 month isn't going to change anything for anyone. But, getting to the point like when you're almost 40 and you're taking 3-4 months off to just relax and get your body back, that could be a little concerning because if it doesn't go well and you have to do it again, and you only have like 1 embryo to begin with or only 2 embryos or something like that, then it would be concerning. So that would be a big
good to know.
Time point. But for someone who is younger, who did well, who has a great number of embryos and would never have to necessarily even worry about putting another embryo back, I think it's absolutely nothing wrong with it. And you said some really important words: emotional, mental status, physical status. Those are all things that, after a stimulation cycle are not completely back to normal immediately.
Yeah. And someone did say, okay, cool, but what about when you're 39? Is a break possible? Which is what you just kind of said. And it's like
absolutely.
a month won't kill you, but you shouldn't really take that long of a break because you are kind of on the later side, which brings us to age in general, right? So a big question that I've received and that I'm seeing in the comments here is what is the right age to start IVF and I'm going to broaden this question to really encompass when you should be checking your fertility.
So everyone knows that basically at the age of 26, 27, 28, women's fertility begins to decline. And it picks up slowly and goes down, and then it gets faster and faster and faster. So as you get older and you hit 35 and 37 and 39 and 40, that decline just starts to go down even more and more rapidly. I think the best answer for that is the earlier, the better. Okay. However, we've seen that every year, I think it's under 10 patients that freeze their eggs under the age of 30. It's just very hard. We're not there yet. I think one day it's going to become a part of women's life. 25, we're freezing eggs. We just finished college. We're freezing eggs. Something's going to happen down the line, but we're not quite there yet. 8 years ago, 9 years ago, when we started freezing eggs, I had the rush of 39-and-a-half-year-old patients into my office, the rush of people who saw they're turning 40, freaking out, and then would come in. So with that being said, I think it's really, really important, okay, to just realize that the earlier, the better. I think a realistic thing that's happened now is 30. So when women hit the age of 30, you should do an AMH test. See how fertile you are. A consult with a fertility specialist is harmless. You can talk, get an overall plan, but you should definitely see where you are at the age of 30. And then I think that for me, if you are 30 and you are not ready to have kids, but you know that there's even a 1% chance in your life you may want to have a child, I would consider doing the egg freezing. When your egg count is good, when your eggs are healthy, when you can do it, it's good. Lots of employers are now covering it, which is great, great news for us. And I love someone just asked for men as well. Studies have shown that after the age of 40, sperm quality in many different categories starts to go down. And God forbid, you're never going to know when you're going to have an accident, have to take certain medications or do other things that could really affect you negatively. So with that being said, we encourage men in their 30s also to freeze their sperm to have there for the rest of their life. So overall speaking, the closer to 30, the better, and the younger, the better. What saddens me is that single women are getting this, but I also have a lot of women that are in relationships that may not be ready. They're two lawyers, they're just starting their careers, they're 32, 33 years old each, and they're just beginning their careers, and you're going to have to work your butt off, we know, for at least the next 10 years. And couples are not necessarily doing it as much as they should, but thinking about freezing your embryos for the future as well is also a really important thing.
Agreed. Someone just asked a great question, which is, can you do an AMH test on the pill?
Yes, you can definitely do it. It doesn't matter what day you are. Now, just be aware, if you've been on the birth control pill for like 15 years straight, there is a chance that that number may come down a little lower than it actually is because your body's really suppressed. But I think it's a great, great time to check it. It does not matter. Just do it and make sure that it's okay. If it's okay, then you're fine. If it's a little low, then I would go off birth control for a month or two and repeat it.
And then is an AMH test a blood test, a saliva test? Is it invasive?
It's a simple blood test that can be done on any day of your month. So it does not have to be on bleeding, not bleeding. Any day you want to go in, you can go and do it. And it's the blood, it's the hormone that comes from the eggs in the body. So we're assuming everyone knows AMH, but AMH is the hormone that comes from the eggs in your body. If the level is high, you have a lot of eggs. If the level is low, you've got low eggs. If your level is really high, there's a very good chance you may have polycystic ovary syndrome.
PCOS, for those
PCOS.
PCOS. So actually someone just asked this about PCOS and having to change dietary situations to kind of help their PCOS kind of get it under control.
Ovary syndrome is a really stubborn disorder that is very much affected by weight. It's the one and only thing that someone can do for themselves if they're suffering from PCOS is to make sure that they get their body weight and their BMI into the normal range. That's the first thing. Studies have shown that if you lose even 10% of your weight, you have a significant improvement in the PCOS issue that you have.
Interesting. And just for those listening, there is an amazing woman named Alyssa VT who kind of has pioneered her whole, she calls it cycle syncing. So eating foods for the right part of your cycle. And she claims that she's helped a lot of women through PCOS and other different infertility variables through nutrition and diet. So if that is something that you are looking for, I would suggest also checking her out. Her company is called Flow Living. So just as a side, note. Yeah.
I need to meet her.
Yeah.
I can't tell you how ignored it is what you eat.
Yes.
And what you put inside of your body and how it affects your well-being and it affects everything else that you're doing in life is so, so, so important. And unfortunately, people are ignoring it. I had the great opportunity that when quarantine occurred to be eating at home a lot. I wasn't having the glass of wine, 2 glasses of wine, going out to dinner. And I wasn't eating all the things that I thought were healthy on the menu because nothing in a restaurant is as healthy as it is at home.
At home, yeah.
And I never felt as good as I did during that time.
I completely agree. And I am very much of the mindset that I try to only eat out. Pre-COVID, try to only eat out twice a week just for that reason alone. And I love being in the kitchen. I find it a meditative thing. So that was really helpful. But I want to also chat about, so someone mentioned what's it called?
Fibroids?
Fibroids, yeah.
Okay, fibroids. So fibroids are little or big muscle balls that grow in the uterus.
Yeah.
And when you have your uterus and you have these little balls that grow in them, they're 99% of the time, they're just benign balls of uterine muscle that grow. But if they're in a bad location and pregnancy implants near one or across from one, it can cause for a lack of implantation or also miscarriage. So we do an evaluation in the office, and I hope that you had, and I'm sure you did, an evaluation of the uterus where we put water in the uterus. The uterus is usually flat. When we put the water in, it fills up like that. So we can check the inside walls of the uterus very carefully to see if there's any bump, lump, or anything abnormal that needs to be removed beforehand. We call it a saline sonogram. We do it in 2D, 3D, and 4D. It's incredible how clearly we see the inside of the uterus. Some places do what's called a simple hysterosalpingogram, or HSG. I'm licensed and I do them here, but it only gives you the outside shape of the uterus. Well, actually, the inside shape of the uterus, but it doesn't give it to you in 3D or 4D, so it's hard to see. It's like something's on the back wall, you may miss it completely, unless it's bulging in from a certain angle. So those are good, but those saline sonograms in 3D and 4D are the best way to evaluate. And if we do find a fibroid, it's a quick procedure. It's a vaginal procedure called a hysteroscopic myomectomy, which we go in vaginally, we shave off the fibroid, and the equipment that we have now is unbelievable. And next cycle, you can do a transfer.
Okay, and so next cycle, you can do a transfer. Okay, so if you have fibroids, you should definitely get the test, the saline test to find out. And generally speaking, fibroids do affect your period, correct? I feel like a lot of women who have fibroids have more on the painful side of periods. So you might have an indication that you do have a fibroid, correct?
I brought a little handy tool, okay?
Oh,
so
here we go.
Didn't know we're going to go there, but we're going there.
Okay.
So this is the inside of the uterus, and this white ball there is a fibroid, okay? And then the little one below it is another fibroid. So this is called intramural. It's completely in the wall of the uterus, and it's not really shoving in on the inside. This one here, the bottom one, you know how it's shoving into the uterine cavity, into the space where the baby is supposed to grow? It's shoving in from here. It's called a submucosal fibroid. That one can affect it. The other red dots, those are all, and the white ones, those are potentially polyps. This is potentially scar tissue or adenomyosis. There's different things, and these are possibly endometriosis. These are all things that we check before putting an embryo back. And those can come back out. And the reason is because it's causing an abnormality in the lining of the uterus, it can cause a much heavier period, and it can cause a lot of cramping during the period as well. So that little model shows that, the lining of the uterus can be interrupted in a horrible way. In a really horrible way. So that's why we're really careful, and we want to make sure that all of the things that are abnormal in the uterus, like polyps and fibroids, they bring down implantation rates more than 50%.
Wow.
Yeah.
Okay. So this is a good question, and one that I feel like I hear this as a recurring story a little bit too often. But what would you recommend if you have recurrent pregnancy loss, but there is nothing pointing to any sort of specific, so like it's an unknown source of what's going on?
I would get a second opinion.
And what if you've had a second opinion already?
So there's a couple different things. So my patients that have recurrent pregnancy loss have obviously been through a living hell.
Yes.
First of all. Second of all, the workup is very large. It involves the husband's chromosomes, the wife's chromosomes. It involves a lot of recurrent pregnancy loss testing. It involves a lot of blood clotting testing. It involves a lot of uterine testing. So I got to tell you, I've had people that have gone to other clinics and then came and I noticed that the clinic only checked the 3 blood tests that the American Society of Reproductive Medicine says is necessary, but not all the others that we check for. So there's a lot of things, and it can go on and on and on. You have to draw the line somewhere, but there's even things like natural killer cells, and there's a lot of things. So I would start off by making sure you got another opinion, that someone went through all your records and made sure that every single thing that was necessary was done, because I don't think there's a reason why anyone shouldn't be able to get pregnant. And if it gets to that point, it then opens up the door of surrogacy. Because if you're fertile and getting pregnant, you have eggs, you're obviously able to make embryos. The world of surrogacy is growing significantly. It is in our practice, at least. And at that point, I would say you could consider that, or a friend of yours, or a sister, or someone that you have in your life to carry.
Okay. I appreciate that. Okay, so I have a bunch of questions also that I wanted to just quickly pull up that we had taken from a previous story of mine. Okay, so we talked about what age to start IVF. We talked about what age we should check fertility. We talked about the difference between fresh and frozen cycles. And you did say that you recommend recessive genetic screening.
So recessive genetic screening, okay, is totally different than the testing on embryo.
Okay.
So let's talk about that. That's so important because I know it confused every patient I ever saw because they both have the word genetic in it.
And I have to say it was confusing as well because I did genetic testing with my husband and I, but we then also did genetic testing on the embryo. And I think that also confused people as well.
And I always had people like, oh no, I don't need to do the genetic testing on my embryo. I'm fine and my husband's fine. So they have nothing to do with each other except that they carry the same word genetic. So pre-implantation genetic testing, PGT, is the process where we look at the genetics of the embryo. It's looking for 46 chromosomes. Every single cell in our body, men are 46XY, females 46XX. So every single embryo, every single cell in our body has those DNA. And that's what we check on the DNA of the embryo to make sure it has normal chromosomes, all 46. The genetic screening, so it's not called pre-implantation genetic testing, PGT, it's called genetic screening, is on man and woman, okay? So we do a test on people. The panel that I use in my office is about 283 different disorders. We use the one called SEMA4. It's a great test. It checks you for almost 300 diseases and disorders. It tells you what you carry, and it also tells you what your partner carries. We want to make sure that the two people do not carry the same disorder. It does not check for chromosomes. Most of us who are here and normal and healthy have normal chromosomes. Now, people that have recurrent pregnancy loss, there are these tiny little abnormalities that are called translocations and transversions. Those things, those tiny little things can affect recurrent miscarriage after miscarriage, and only 1 out of their 6 pregnancies generally can make it. So that's why we check the chromosomes on those parents. But for anyone wanting to have a kid, we always check the genetic screening. And if anyone is using an egg donor or a sperm donor, we also really encourage that the egg donor and sperm donors be checked as well. Now, if two people carry the same disorder, we don't tell you to get separated, okay? But there is special testing that then you can, on the embryo, that could be done for the actual disorder. So for example, in the Caucasian population, most common is cystic fibrosis. 1 out of up to 19 people can be carriers of it. In the African American population, for example, sickle cell is the most common genetic disorder. So we see these all the time where husband and wife are like, oh my God, thank God we checked, but we now carry the same disorder. We can then, in addition to the 46 chromosomes being checked on the embryo, we can actually, with something called single gene mutation testing, check for that disease on the embryo.
Amazing. Okay. And I just want to side note that I actually worked with a company, a genetic screening company called Invitae.
They're great as well.
They're great. And I just want to stress that during a pandemic, they are a great option because they send you an at-home test that you take via saliva, which is what Brendan and I did. And I partnered with them. I had done a different test with them earlier in 2019. And then in 2020, I did it with Brendan. And we talked about it, but it was confusing for the community because everyone was like, well, this seems like such a weird thing that you're doing and like just a paid ad because you already tested your embryos. But in reality, it actually was testing Brendan and I for if we were both carriers of the same thing, which luckily we were not. And it's an at-home test you can take. And it kind of, if you're one of these people who your IVF cycle has been pushed back because of the pandemic, and you feel like you want to just keep the momentum going, this is a test that's available to you to do at the comfort of your own home. And it's a medical grade test. So it's a great option. Okay. So I'm glad we covered that, the difference between the PGT and is that what is it? PGT?
PGT, pre-implantation genetic testing versus genetic screening.
Versus genetic screening. Okay. Okay. So we touched upon this just really briefly about the costs of IVF. And you did mention that a lot of corporations now are covering costs of IVF. I also want to just highlight that depending on what state you live in, sometimes IVF is also covered by your state. And yes, IVF is expensive, but between the insurance with whatever corporation you're with, state covering, you can kind of lower these costs. My personal insurance didn't really do much.
We recently on my Instagram page did a little survey asking people, like, what's your number one barrier doing egg freezing or fertility treatment? And hands down, it was the cost. And I feel horrible, but I got to tell you, it costs a lot what we're doing in the lab. We have tons of people working here that are trained at specific little things. The equipment and the fluids and the mediums and the incubators and everything is very, very expensive. And if you don't use the best of the best, you don't get the best results. So that's really important thing to recognize. With that being said, we are having a summer egg freezing special. It used to, when egg freezing came out, it was like over $10,000. Then it went down to like $8,000 something. We brought it down now to $6,400. And as of now, it's the cheapest anywhere in Southern California and also at the #1 IVF lab in Southern California. So we're very proud to be able to do that. It was to kind of give back to the community. During the pandemic, everyone was hit so hard in so many different ways. We really wanted to help the community. And it's going on until the end of September. So
that's amazing.
If you get your foot in the door before September, we're happy to help. I don't know what's going to happen after September. So I encourage anyone. And the thing, we've had so many people fly in and do it. What we do is that we allow people to find a local fertility center to help them do their monitoring. And when it gets close to the actual egg retrieval process, they fly in a little bit before and we do it here and then they can go back home. So $6,400 is pretty good. We also have different financing options that we don't do ourselves, but our financing partners, they help. And we've gotten it down to, I think it's like as low as like $180 something a month, or
Wow.
160. It depends on your credit, but it gets it down to a very, very low number.
That's amazing. And like, that's so awesome that you guys are doing that special and that sale, because it does break down that barrier of entry and make it more accessible for more people. So that's really amazing that you're doing that. So those were kind of all of the questions that I got. A lot of the questions, a lot of the rest of the questions are kind of on my own personal journey, which I'm going to do in a different like IGTV, just talking about what I did to kind of prepare myself for my transfer and how I was able to kind of, you know, emotionally prepare and all that type of stuff. So if there's anything that you feel like we didn't hit today, we should try and do it now. But
first of all, I think the questions that came through were all excellent. So thank you for keeping track of those. You know, I think being proactive about this entire process is very, very, very important to kind of get people to move forward. One thing I did want to say that we have upcoming is I recently, with the owner of Natural Pilates here in Southern California, did a little 20-minute video of exercises that are safe. And I was wearing gym clothes and I did it with her. Laura Wilson and I made a little video because people go crazy, I realize, not being able to move and being told not to exercise at all during this whole process. So we'll have that coming up real soon, where we're going to put a nice little simple video of simple moves that can be done to keep a little bit of blood flowing during the process. And it would also, we made it very clear of when in the cycle you're okay to do certain exercises up to. So that will be coming up soon. And I'm going to put that on my YouTube channel. So that'll be great. But I think this was fantastic. I cannot wait to see a picture of your little baby and to hear great news. I'm so happy for you and your hubby. And I'm really commend you on being open about this, because I can't tell you how many people you're helping out by even talking about this.
Thank you so much. I really appreciate that. And I'm so glad we were able to do this. And I'm sure we'll get a lot more questions even after this. And, you know, we can always do another one, because I'm always down to continue this conversation.